At its core, health visiting is about building relationships and supporting families through various stages of life. Whether you're an experienced health visitor or at the beginning of your career, you will know the value of building trusting relationships with families. In this podcast, I am joined by professionals from across the variety of professions to discuss genomics, its relevancy from the moment we are conceived through to starting school, and the central role that health visitors play to ensure continuity of care across multiple agencies. In this episode, I'm joined by Gill Moss, lead nurse for the North West Genomic Medicine Service Alliance, our colleague Waheeda Abbas, who's our midwifery lead, and Sally Shillaker from the Institute of Health Visiting and Genomics England. Gill, to start things off, let's lay the foundation and ask what exactly is genomics?
So, genomics is the study of an organism's entire genetic makeup, including its DNA sequence and the interactions between genes. But you may ask yourself, how does genomics relate to public health? Well, that's where things get really exciting. The information stored within our genes can provide valuable insights to our predisposition to certain diseases, our responses to medications, and even our susceptibility to environmental factors known as epigenetics. This knowledge has immense potential to transform how we approach public health initiatives. Genomics can also enhance our understanding of how an individual's genetic makeup affects their response to medications. This is called pharmacogenomics, and it has the potential to revolutionize medicine prescriptions, ensuring that patients receive the right medication in the right dosage, as well as minimizing adverse effects and enhancing treatment outcomes. One of the most significant contributions of genomics to public health is in the realm of disease prevention. By analysing an individual's genetic profile, the presence of certain genetic changes or mutations that increase the risk of specific diseases can be identified. Imagine being able to tailor or personalise healthcare and health recommendations based on a predetermined genetic makeup and identified risk of developing certain cancers or disease before they manifest itself.
Thanks, Gill. Sally, can I bring you in at this point? In relation to health visiting and public health, why is genomics relevant?
Well, thank you, Barbara, and good to be here with you all. So I think genomics is highly relevant to health visitors for all the reasons that Gill has identified in terms of what genomics can now offer in healthcare, but relating this to children and families, which is kind of where health visitors work. All health visitors are qualified nurses or midwives, or perhaps both, with specialist public health training. And we work very closely with children and families, really from the point of antenatal contact. And we care for those families by supporting them until that child starts school. And actually, at that point, what happens is we hand over the care to the school nursing team, who also are like health visitors in a specialist public health role. And the aim is very much to work with the family, but place that child at the centre of the care. There are kind of mandated contacts that all children are offered, but within the context of public health, we really work to promote health. We're seeking to ensure the healthiest outcomes for everybody. We're looking to reduce or prevent ill health, and always looking to identify factors for children and families that may mean that they have poorer health outcomes and seeking to address those. So there's a growing evidence base of the importance and sort of paramountcy really in terms of future health of the first 1,000 days of life from conception to about the age of 2. And this is really an important message that we know now how vital it is to really invest and look at the kind of health outcomes, if you like, in the long term by giving those 1,000 days a real paramountcy. So for children, we know that most rare diseases, a high percentage of rare disease has a genetic cause, and that most rare diseases are also detected in early life because they're genetic, they affect that child early on, but that babies particularly and young infants can't actually tell us what's wrong. So they often have a very lengthy diagnostic odyssey, which means the kind of length of time it takes to find out what's wrong with them. So really, it's so important that health visitors therefore have an appreciation not only of where they can be very instrumental in supporting a family, perhaps for a child who has a rare disease, but also in understanding kind of where they fit within the NHS and the care that can be offered, so that actually they can be curious and kind of looking out for possible signs that maybe a child may not be meeting their milestones, so that they can really start to link in with the specialists who that child needs to see to get that support early. Because as with most ill health, knowing early really makes a difference. And, you know, for children with rare disease, it may mean that they actually get treatment sooner, and certainly management by specialists, which health visitors will be part of. But, you know, the kind of right people are being of looking after that child. So that's kind of where I think it really matters. But the other thing, and it's a really important point, which perhaps I should have said first rather than last, is that we're really invested in equity of access and equality in healthcare. And what that means is that every child has the right to have good healthcare. So we need to be really invested and aware that actually genomics applies to that too. So picking up where things aren't quite right and making sure that every child and family kind of has access to the right healthcare and good quality care is really important.
Thanks, Sally. So it's clear that genomics has a part to play within health visiting and its network of care, and that involvement really starts from a moment that care is transferred from midwifery colleagues. So, you know, Waheeda, if I can come to you, how vital is collaboration amongst healthcare professionals so that genomics are successfully integrated within midwifery practice, but also health visiting and public health practices too?
Yeah, of course. So we know how important it is to note that genomics offers numerous benefits, but it also comes with potential challenges, such as having access to genetic testing, addressing potential health disparities and inequalities, and also maintaining patient privacy. And it's crucial that there is a collaboration amongst all health professionals, such as genetic counsellors, policymakers, and researchers. And it's essential to integrate genomics into health visiting and public health practices successfully. We all need to be aware of cultural sensitivities, understand the cultural nuances in family dynamics, and also to avoid assumptions and embrace diversity to support health equity for all communities within our populations. Nurses and midwives and health visitors hold extraordinary relationship with their patients and their families, which becomes more vital as the Generation Project rolls out. Newborn screening and early intervention will support colleagues, work in health visiting, genetic counselling, education, vaccination and immunisations, public health policy and planning. And when we're discussing genetic information with individuals and families, we must be culturally sensitive and also consider ethical considerations. In my role as a specialist cultural liaison midwife, I have a real opportunity to make maternity services responsive to the needs of our diverse communities we serve. And that means looking at the cultural beliefs, values, privacy concerns, and ensuring that they're respected at all times. For example, a patient's traditional belief it may differ from a mainstream practice, and they may view receiving genetic results and making decisions based on that information as a family affair, which is a very common practice. Other cultures believe that language can shape reality, so receiving news about an increased or inherited risk of a certain disease or condition in a negative way, it can be really, really distressing. And if we don't take into account cultural factors, that can instigate the stress and upset that they're already in a difficult situation.
Thanks, Waheeda. If I can come to you now, Sally. with ethical and cultural considerations, what have been your experiences, and what would your advice be to colleagues to ensure that there's cultural awareness, sensitivity and competency, and that it's applied within health visiting?
I think that's a really important question that we, as professionals, really need to be asking ourselves kind of every day when we're walking into and supporting our families. And I don't claim to be an expert at all, because I think it's a really diverse sort of area of practice that we can only get better at. And we owe it to our children and our families to have that kind of open lens of curiosity, and always thinking that there's a lot more that we probably don't know rather than we do know. And I think in relation to genomics, there are many issues around cultural awareness and sensitivity, ethics, that we do need to embrace and be kind of up for developing our competence in. And I think about that relating to how we go about perhaps having conversations with families. Perhaps as a health visitor, we might be the first person that a family has come to. Perhaps we're providing a home visit, or perhaps we're seeing them in a developmental context that they come, and they are worried perhaps that their child isn't meeting the milestones that they know they perhaps should be. So we may be the first person, and this is a hugely bold and sometimes quite difficult conversation that parents are needing to have, because nobody really wants to have a conversation about their child or baby for whom they're worried about and perhaps not meeting milestones. So the fact that somebody has started that conversation, or sometimes as practitioners we actually have to be the ones that are starting that conversation. So how we go about doing that does really need cultural sensitivity and tact. And I think fundamentally we need to be asking parents to tell us. So my approach is never to make assumptions. It's always to ask permission. It's always to navigate mainly by listening rather than telling. Using the skills that we have got, but also using the skills of others where that's highly appropriate. So perhaps, for example, there may be a need for a translator or interpreter if there's a family perhaps for whom English is difficult or not their first language. It's about reassuring them that as part of our professional care for them, that where we might be taking a referral or making a referral, where that goes and who it goes to, and sort of supporting that family with clear outlines of what they may expect. So whether that might be a referral perhaps to a community paediatrician, giving them a flavour of who that paediatrician is and what might be the timescales and how they might be referred, and kind of ultimately other sort of professionals that may be involved. So I think at all points it's about having a real heightened awareness of carefully navigating with the family in front of you, and asking them to sort of share with you what they want to know, because sometimes people don't want to know everything, sometimes people do want to know everything. It's about what, and then about pitching what they want to know at a level where you're getting feedback that they can understand. So for example, within the kind of field of genomics, we may need to we may have wording issues that people perhaps don't understand, terminology, so we need to be able to sort of break that down and explain it, perhaps do drawings, revisit things, signpost to resources that are in particular languages or are particularly helpful, or if you've got an older child, using the kind of wealth of resources that are age appropriate. So I think there's a lot that we need to be working on. And the other thing I would just finally say, which I think health visitors and many professionals do, which we also need to offer, is this sort of sense of containing the family, so making them feel secure and knowing where those boundaries are, because often with something that's a sort of new and evolving healthcare need, Nobody quite knows where this is going to go. So to make people feel safe and for them to know what's happening next is hugely important. And I suppose also to help sometimes, especially within genomics, think about their understanding of the impact of a diagnosis on the whole family, because you suddenly have issues about inheritance, and how to support that, and also where that might lead and who else might be needed, or might be offered testing within the family. So there are many sort of uncertainties, which is case by case. But I think fundamentally, it's about navigating that with the family in front of you and seeking help from other experts and colleagues when you don't know kind of quite what that might mean. So, for example, if you're talking about a referral to perhaps genomic specialists or a clinical geneticist, who is that person and what sort of role do they have and what might that mean for that family? Just helping to unpack helps families to not only know but also feel safe and contained in this sort of diagnostic odyssey.
Thanks, Sally. Jill, if I can come to you now, what other considerations should be made? I'm thinking in relation to mental and emotional support following genetic testing and a diagnosis, or equally important, a non-diagnosis.
Thank you. Of course. So genomic information may highlight unexpected, unknown inherited risk of developing certain conditions. Nurses, midwives and health visitors, we all need to be able to provide support to families as they navigate what can be an extremely emotional, distressing time, and try to help them to understand the implications for health and well-being of the family following a diagnosis, as well as where no diagnosis is made.
To close this podcast, I'd like to ask each of you in turn to sum up why genomics is critical within health visiting and public health as a whole. Jill, if I can come to you first.
Of course. So genomic enables professionals to identify risk, personalised treatment and medicine to improve efficacy and avoid adverse reactions, as well as identify disease earlier and potentially disease prevention.
Thanks, Jill. Waheeda, can I come to you?
Yeah, of course. So understanding the genetic history of a family provides such invaluable information. Thus, it's really important that health visitors maintain a relationship, and which enables them to support families to gather and interpret the information at patient level, and in order to help them understand the implications, which includes ethical implications of genetic testing, as well as discussing screening, lifestyle changes to lower the inherited risk, so that decisions can be made in an informed manner. Thank you.
Thanks, Waheeda. And finally, Sally.
Yes, thank you, Barbara. So in summary, health visitors play a crucial role in promoting health and preventing illness. So as I said, the integration of genomics has significant benefits as well as implications. First and foremost, personalised care. Health visitors can use genomic information to tailor their advice and their recommendations and interventions on perhaps specific genetic risks. But this approach really supports the identification and addressing of potential issues early and leading to more effective care. And that's really what we want, because we know that early intervention in most aspects of care really does make a difference, and that's what we want for these children and their families. And also, and I think really importantly, it's about equity of early intervention. So actually what we want to be doing is to provide an equitable service, which basically means that every child and their family receives the same service. And sometimes with genomics, because it can be maybe not so well understood, or historically people do have some quite big concerns about genomic practices, we have much to do by way of explaining kind of where we are today and reassuring people and being really transparent about what the difference in our understanding will bring to their child's care. So I think there's a lot to do about educating not only ourselves to become more confident and competent, but really about then translating that knowledge into helping parents and children to understand kind of genomics.
And in support of that, where can we provide effective signposting to colleagues that are listening today?
Main thing to mention, well, there are a few things, but first we must make mention of the fantastic website that you have within the Northwest GMSA, which is full of really useful information and contacts, but sort of cites what's going on locally, and you have events that people can get involved in, and that's really vital that people know kind of where to go and what's going on in their local area. I think alongside that is the Genomics Education Programme website. Now, they are now sitting as the Genomics Education team within NHSE. However, their website is fantastic. They are there to equip the whole NHS workforce in terms of thinking and understanding genomics. And so they have a range of resources and some fantastic items on their website. I mean, they have, for example, a bespoke webpage for nurses, and then another one for midwives, and actually more recently for health visitors, which we're really pleased about, as does the Northwest GMSA have a page for web for health visitors, which again we're really, really pleased about. But the thing about the Genomics Education Programme website is you will find masses of different types of resources. So it may be that you have a question about something, a condition or kind of a cause of condition, that you just don't understand the terminology. You could go there. There's sort of bite-sized resources. There are videos. You can then get yourself involved in kind of modules at master level. So there's heaps there. And then also within the Institute of Health Visiting and the Genomics Education team at NHSE, we have been commissioned to deliver a project which is all about equipping the health visiting workforce, so every member of health visiting teams. And we are planning an event with the Northwest GMSA, which will be the first, and we will evaluate it to equip the workforce, and we're really looking forward to that. So if you are in the Northwest, this is an event that we really hope to have teams represented at the end of March, April 2024. And I think finally, just to say, it really should be on the radar of all of us, because it probably will affect all of us through some way, is the Generation Study. And this is a large research study that will be live from the end of January 2024, which is looking to recruit 100,000 babies for whole genome sequencing to look for about 200 rare conditions that, again, if we know about early and we get early help, will improve the outcomes of those children. So it's a research study very much running alongside all NHS care. It is not replacing NHS care, but that might be well worth a look as well, because it's highly likely that sites within the Northwest are going to be on board shortly. Thank you.
Thanks, Sally, and thanks also to Gill and Waheeda, and to the listeners that have joined us for this podcast. If you would like to know more, then please do visit the Institute of Health Visiting website and the Alliance website, which, as Sally mentioned, has a dedicated education and training page for health visitors.